low back pain, and golfing. More and more people are playing golf. You can participate in this sport at any age, young or old. Golfing attracts both males and females, even people with modest incomes. A high level of performance is not limited by the person's age. The older an individual becomes, the more addicted they get to playing golf. However, injuries can occur during golfing. The most common complaint from golfers is of pain in the lower back. 30% of golfers experience problems in the lower back that affects their ability to play and enjoy the game of golf. Most of these injuries are the result of overuse, too much playing, and poor swing mechanics. Even carrying a heavy golf bag can contribute to injuries of the lower back. There is no doubt golfing has health benefits such as improved cardiovascular fitness. The benefit of being outdoors and receiving sunlight will help in production of more vitamin D inside the body. Golfing can be a low-impact aerobic exercise. The players usually walk a long distance and receive a reasonable amount of exercise. There is a social interaction of playing golf that improves the morale and decreases anxiety and depression. The golfer's back is often placed in an unnatural position, and the golf swing produces increased loads on the spine and back muscles. The health benefits of playing golf outweigh the risk of back injuries. The lower back pain can be acute due to trauma or chronic and gradual due to cumulative load theory, the total stress being placed on the system over time, and also due to asymmetric distribution of stresses on the back during the golf swing. The golfers may experience muscle strains, herniated discs, stress fractures of the spine, facet joint arthritis, and spondylolisthesis. The spinal mobility decreases with advancing age, and as people get older, they may have more sedentary lifestyle, and the muscles become weak and tight. And that will decrease the range of motion and the flexibility of the spine. The rotational forces, the torque, and the twisting of the lower back can create a risk to the lower back muscles and to the lumbar spine. The swing of the golf club creates a huge amount of force from one side of the body, unevenly placing pressure on the spine. High compression, shear, lateral bending, and rotational forces exist in the lumbar spine during the golf swing. The pressure experienced in golfing exceeds the pressure which is needed to cause a herniated disc. The compressive load during golfing is equal to 8 times the body weight, while these forces are about 3 times the body weight during running. The golf swing produces sufficient force to potentially injure the lumbar spine. So the cause of the low back pain is multifactorial and can include the following factors: excessive amount of playing and practicing golf. People who develop low back pain typically work longer hours than the asymptomatic people. Also, the asymmetrical, forceful nature of the swing, flaws in the mechanics of the golf swing due to over-rotation of the spine, abnormal muscle recruitment, and poor trunk endurance. During the golf swing, the lower back receives a compressive force of 1,370 pounds in the amateur golfer and 1,700 pounds for the professional golfer. In comparison to a college football player experiencing a compressive force of 1,950 pounds while hitting a football blocking sled. To rupture herniated disc, you only need 1,220 pounds of force. Treatment. One must understand the phases of the golf swing and the forces and biomechanics of the lumbar spine. The most important treatment is preventive treatment. Participation in a golf-specific exercise program which focuses on the muscles of the body that are used in the golf swing, especially the core muscle areas from the shoulders to the knees. The muscles protect the spine and generate the power needed in the golf swing. These muscles are the abdominal muscles, the lower back muscles, the buttock muscles, and the hamstrings. In order to prevent injury, increase the strength, the endurance, and flexibility of the hip and trunk muscles. You try to eliminate any excessive stress in the lower back and decrease excessive practice and play. Avoid carrying the golf bag. You need to improve the swing mechanics. If injury occurs, the patient will get rest, modify activities, non-steroidal anti-inflammatory medication, physiotherapy for increased range of motion and flexibility, have active stretching of the muscles, and treat any muscle asymmetry. You must do warm-ups before playing golf. This will prepare the muscles for the activity and will reduce the risk of injuries. Ice of the painful area and massage of the muscles of the lower back may be helpful. Thank you very much. I hope that was helpful.